Hi, my name is Brigitte Unger Graeber. I'm a GP in Hounslow and I practice in Chiswick. We see a lot of atrial fibrillation patients in our practice because it's very common and you could basically say it's our bread and butter. So let me tell you a little bit more about atrial fibrillation. Atrial fibrillation is an arrhythmia of the heart, basically a disturbed arrhythmia of the heart. It's different from your normal sinus rhythm, and the way you might feel it is that it causes palpitations, shortness of breath, dizziness, tiredness, sometimes even chest pain. Often the symptoms are not recognized or are interpreted in a way that people think, oh, it's normal that I have a little bit more shortness of breath, or it's normal that I'm not as fit because I'm getting older. But that's often not the case. So atrial fibrillation is common. About 7 in 100 people have it. It is often in conjunction with other heart diseases like high blood pressure, hypertension, heart failure, ischemic heart disease, or after a heart operation. It causes often irregular and fast heartbeat, much faster than your normal heartbeat, and that's what leads to the symptoms that I described before, like dizziness, shortness of breath, tiredness. Atrial fibrillation is not a life-threatening disease, but unfortunately, if it's not detected and not treated, it can cause a stroke. So how do we diagnose atrial fibrillation? There are several ways of doing it. One is actually to just feel your pulse and do that for at least 30 seconds, and you may feel that it's actually irregular. I've heard the story actually where the wife was laying on her husband's chest and could hear the irregular heartbeat. So where may you be referred to for further testing? If your ECG is indeed abnormal and shows atrial fibrillation, we may send you to get an echocardiogram, which is an ultrasound of the heart, which can show us in real time the 4 chambers of your heart, the heart muscles, how the heart is pumping, how the valves are opening and closing, and it can show us if the heart muscle is normal or if it's damaged by ischemic heart disease, or if it's thickened by hypertension, or if one of the valves is not working properly. And in Hounslow we actually have a community service, so we can refer you directly to get the echocardiogram done, and then the consultant reports it and sends us a report back. The other test we may ask you to do is a chest X-ray, because there can be underlying lung disease, for example COPD, chronic obstructive pulmonary disease, that can cause atrial fibrillation. And of course we would usually do blood tests like a full blood count to rule out anemia, your thyroid function, because if you have a thyroid overfunction that can actually cause atrial fibrillation, and we would check for risk factors of other heart diseases like your cholesterol and blood glucose. So once we got all the test results back, your GP would sit down with you, we would explain the test results to you, and then we would check if you need to go on anticoagulation to prevent a stroke. For that we use a so-called decision tool. It's called CHA2DS2-VASc score, and if the CHA2DS2-VASc score says that you should actually go on anticoagulation, we use another tool which is called Hasbled score, which actually tells us if you're at higher risk of bleeding. And then once we know if you need to go on anticoagulation or not, the next step is to determine how we treat the symptoms of atrial fibrillation. So there are actually 2 options. One is called rate control and the other is called rhythm control. The rate control is usually done by your GP, and what it entails is a medication that slows down your heartbeat so it's within the normal range between 60 and 80. If you need rhythm control, then you actually need to be referred to a specialist cardiologist, often a electrophysiologist, who can apply then either a so-called chemical cardioversion, which is done with medication, or an electrical cardioversion, which is actually done with an electroshock or an electrophysiological so-called radio ablation therapy, where there is electricity applied to certain points in your heart through a catheter. Now, I understand that all of that sounds really scary, but believe me, it is not. All the specialists who are applying these methods are very well trained. They've been doing it for a long time and they're really good at it. And the important thing is that unless you get diagnosed and treated, you're not getting better, and also you're at risk of stroke.